Was it time?
You guys are live.
Hi everyone. Hello.
Hi everybody. Let's see.
Let's see. All right, we're live.
All right.
We are live.
Let's see. Where's everybody logging in from? Shoot us a text and tell us where you're logging in from. Maryland, Virginia, DC, New York, Miami, Texas, Las Vegas, Iran, Costa Rica. Where you guys logging in from? Let's see.
Oh my goodness. Oh my God. All right, guys, we're so excited. Our second collaboration. I'm so honored to have Dr. Retana, one of the best in GMB, the king of BBL in the house. So we're very excited. Thank you for joining us. We're going to cover so many fun stuff tonight. Our goal is always to educate our patients, share our knowledge, share our experience, and honestly learn from the experts. So thank you for being here. Let's do this.
Thank you for inviting me again.
Of course.
So yeah, obviously the goal is always to educate people. So we're here tonight to talk about skin quality. The theme tonight, you don't want to miss this talk. I've been telling all my patients for the past 2-3 weeks, skin quality is the most important thing for everything, for aging, for liposculpture, for liposuction, for BBLs, for everything, abdominal etching. So tonight we're going to be talking about skin quality, skin tightening, what you can do to improve your skin quality. If you go to any surgeon, the first thing he's going to look at is your skin quality. So you want to stay on tonight. We're going to talk about, 30, 45 minutes or so about skin quality, skin tightening, and what we can do to help you. And what patients can do for what? For facial rejuvenation, for prevention, maintenance, getting ready for surgery, right? After surgery care, everything. So just stay tuned.
Yeah, and I think if you guys understand the process, it's very simple. To me, it's like baking a cake. There is step to it. You cannot miss one skip hoping that you're going to achieve that goal. You know, if you want to bake a cake, you have to buy the right ingredients. You have to spend enough time. You cannot rush into things. So I always have this conversation with my patient that you don't want an easy way. You want it the right way. You don't want to just jump into something because you just want to achieve the goal and like your goal is so temporarily, but you want something that is long term. It's going to benefit you. And so one of the piece of advice that I have to every single patient, because you guys come to us, all you ask is usually, well, to surgeons are a little bit different, but to me it's like Botox filler. But I always ask my patient, I'm like, tell me guys, what do you do to prevent you from losing collagen? What have you done? And majority of my patients, they really like, well, I have had some facial, some chemical peel. Keep in mind, chemical peels are really good for anything resurfacing, meaning like, you know, the first layer of your skin. You want to get rid of like dead skin. You want to get a deep exfoliation. You want to clean your pores. Those are so important. Your sun protection is so important. But when we're talking deep, when we're talking about your second layer, there's nothing in the market can do for you to target your second layer, which is your dermis. And I always tell my patient, your dermis is your collagen factory. And after age 30, this factory slow down. What does that mean? It's like, okay, we're done. We're done with growing. Now we're going to start losing things. So number one goal is to maintain things. And number two is to gain them back, right?
Yep.
So what are your thoughts about like any skin tightening?
So I mean, the main thing, like, you know, when people, like, you just started talking about Botox and fillers, right? Why do we do Botox and fillers? Is because we want to maintain our youthful look, right? We want to stay young, we want to look beautiful, young, beautiful, right? And yeah, we have Botox, we have fillers, and we have surgery. And, you know, like, someone asked me, like, you know, what is like the best 2 things that I can do to stay young forever? And I'm gonna tell you right now, if you like the most bang for your buck, the 2 things, if you're not gonna do anything else but these 2 things, are Botox and Morpheus 8. Morpheus 8 is a skin tightening device. It's kind of like microneedling. I'm sure you guys have heard of microneedling, right? Like, it's super famous right now. Microneedling, vampire facials, that kind of thing. Well, the microneedling pen is just like this little microneedles that kind of scratch your face, and that's it, right? This one is microneedling on steroids, right? It's microneedles too, that sort of scratch your face a little bit, but it also delivers energy, radio frequency to your skin, to your face, or to your body to stimulate collagen.
Absolutely.
Right? So collagen is the main thing, and to stay youthful, and also obviously Botox and fillers. But anyway, so we're going to be talking about Morpheus 8. This technology is amazing. I don't have it. Nurse Yalda has it, and let me tell you, I talk to my patients all the time about this because my main thing that I do in my practice is liposculpture, right? I sculpt people's bodies, but I depend on their skin quality. So, now that this technology has been in the market for many years, and has been proving that it's really, really good, I've been talking more and more to my patients about doing it pre-operatively and also post-operatively. Tonight, you're going to meet one of my patients who we did liposculpture on, abdominal etching and everything. I'll give you her demographics when we get to her, but she needs a little bit of skin tightening, and we're going to show you guys how we're going to start the process for her. Okay?
So my question was for your patient that she had liposuction, why weren't you able to do a tummy tuck? Because a lot of patients okay, maybe I don't need skin tightening, I will do tummy tuck. Because tummy tuck, you are removing that extra skin, correct?
Yep.
So what is the reason that?
And I always tell the patients, listen, there's a few options here. We can do liposuction and see how your skin reacts and how your skin improves over time after the lipo. Or we can go straight to the mini tummy tuck. If a mini tummy is what's indicated on Tanya, I believe it would have been a mini tummy tuck and not a full tummy tuck. Some people don't have enough skin for a full tummy tuck. But obviously everybody wants to avoid that scar of the mini tummy tuck, especially if you never had even a C-section scar, right? You don't want the scar down there. So if we can avoid it, if we can get away with it, I will try to get away with it as much as possible. And this technology, Morpheus 8, is what's going to help
phenomenal,
us.
yeah.
Either pre-operatively or post-operatively. And so you're going to see that. Yeah.
So talking about Morpheus 8, it's what I love about it. It's
in 1 second.
Yes.
I'm sorry to interrupt.
So many questions.
That's the other thing. If you guys have any questions, we would love to interact with you. This is not meant to be a lecture.
Yes.
I don't like doing lectures. I like interacting with people. So please, if you hear something, if you want to ask something, shoot, because we're reading your messages right here.
Yeah.
We want to know what questions you have. We can always deviate a little bit from our what we have sort of planned to talk to you guys about, and go into interacting with you guys. So please go ahead and ask.
And Najim, if we miss any question, please just ask us the question in case we miss anything, if anything important for. Thank you.
All right, let's do it.
You got it. Awesome.
Sorry, no.
Okay, no, of course, thank you. I just want to make sure we answer everyone's question. So guys, basically, Morpheus 8, it's a combination of two technology together. I love it both because not only we're using the microneedling. The needle is about 25 needles. It goes deep up to 4 millimeter or 6 millimeter. So it's pretty deep. And what it does is also, in addition, the radio frequency, that little energy, that little zap, it also delivering the energy to the skin. So every time we cause trauma to your skin, controlled trauma, keep that in mind, it's a controlled trauma. So basically your skin is okay, I got injured, I have to heal. And what is healing? Healing is regenerating cell, regenerating collagen. So this is how we help your skin to kind of start gaining more collagen, maintain the collagen, and keep your skin healthy and beautiful. I have had so many patients that they are booked to have their neck lift, facelift, but their surgeon told them that, hey, you need to improve your skin quality. So again, we're talking about skin quality because even if you're going to get a facelift, it is so important to make sure your skin is healthy, your skin has enough plump.
Yeah. Even so, if you're going to invest in surgery, right? You decided. Let's say we have an audience here that says, I'm going to get a facelift or a neck lift, right? I have my mother's neck, I have my father's, I have my family neck, and I want to improve my neck. And you do a neck lift with me, or a lipo of the neck, or a facelift, right? And you pay the money that it takes to get that procedure done. And you want to protect your investment. How can you protect your investment? Well, you can't really go and hit the gym to improve your face, right? Maybe a little bit of the neck to maintain your weight. But what you can do is you can get Morpheus 8 to stimulate the collagen in your skin to continue to have those good results for a very long time. That's what you can do, right? obviously when I do liposuction on people and liposculpture, one of the ways they protect their investment is they hit the gym and they maintain their weight. But again, how do you improve your skin quality? There's no exercise at the gym that you can do. There's an exercise in a med spa that you can do, which is Morpheus 8, which you can just, come get sessions done and get that skin quality improvement.
Someone's asking, where are you located? Dr. Retana is in DC. I'll make sure I share his information with you guys. I do have his
it's
Instagram
very easy.
page.
It's very easy. Just go to my Instagram page, link in bio, and
you have all the information
and you'll have all
there.
the information there for sure.
So one other thing also about skin quality. Okay, so we talk about the first layer. That's your epidermis. That's the first layer. So there are going to be problem like brown spots, sun damages, age spot, discoloration, hyperpigmentation, hypopigmentation. What all that means, it's like your first layer needs to be clean. It's like, imagine you wear this white shirt and now you had some hot chocolate on it and it's dirty. So we have to clean it. We have to get rid of all that discoloration. We have to get it nice and clean. So what is discoloration? It can be brown spots, sun damage. It can be melasma. Melasma is hormonal, but there's also a little bit of the Morpheus 8, but something in addition that we use to get rid of this discoloration from the surface. So it's not only the dermis, the bottom, it's also the top that we have to make sure we do resurfacing and get that skin glowing, healthy. One question. So Dr. Retana, tell us about your liposuction and if everyone is a candidate for liposuction.
No, not everybody is a candidate for liposuction. Some people. It's all about, again, it's all about skin quality, right? If you have loose skin, right? If your skin looks like my shirt right now, you can appreciate my shirt. You can see my shirt. If it looks like my shirt, right? It's already hanging. Then there's no liposuction that's gonna improve that. We can do liposuction when there's mild skin laxity, but when there's moderate or severe skin laxity, there's no surgery or device. People talk about J plasma, people talk about other technologies, what if you use enough J plasma on me so you can avoid a tummy tuck on me? Not really. Again, only mild skin laxity can some of these devices during surgery improve skin quality. And I'll tell you this is my opinion on it. This is may not be some other surgeon's opinion on this. But the reason I don't use J plasma, some of these skin tightening devices during the surgery, is because I'm already introducing a ton of trauma to your body by doing the liposculpture, right? And the one thing I don't want you to get is fibrosis. So J plasma and other technologies have shown to increase the chances for you getting fibrosis. What is fibrosis? A bunch of scar tissue underneath your skin that makes you look lumpy, bumpy, and ugly. And so I rather do pre-op treatments, like before your surgery, and after treatments, and only hit the target, which is your skin, instead of using the J plasma, which targets the underlying tissue plus the skin, and then making you more likely to get fibrosis, which is really hard to get rid of. So that is my opinion. I always get DMs on Instagram like, do you do J plasma? Do you do this? Do you do that? And the answer is no, I don't do J plasma, because I'll tell you this. Some of the big shot surgeons in Colombia, which the techniques that I follow are from Colombia, even though I was trained in the United States. Some of the big shot guys in Colombia are taking away their J plasma or basically throwing it in the trash or selling it because they're seeing how much fibrosis it's causing their patients, right? Yeah. And the other thing is this. Here in the States and other places, people that have that technology, J plasma, it's only indicated for people with mild skin laxity, right? Mild skin laxity. But they're taking people with moderate or severe skin laxity. And then they're like, well, if I do 2 or 3 passes for someone who has mild skin laxity, I'm going to do 6 or 7 passes for someone with moderate or severe to try to prevent that tummy tuck, to try to prevent that mini tummy tuck. And guess what they're doing? They're creating more fibrosis. So by the time you need that mini tummy tuck or tummy tuck, there's more so fibrotic tissue, and then it's harder for you to go do a tummy tuck, because now before, when your skin was not fibrotic, your incision could be really low, and now guess what? Because it's so fibrotic and the skin won't stretch far enough, then you have to do a higher incision, and that is really hard to hide. in a bathing suit. So, yeah.
Wonderful. Within a few minutes, I'm going to numb our patient, our model. She was so kind to come and join us, and then we'll talk a little bit more of what Dr. Retana did for her. So before I go, I have a question to ask Dr. Retana. So,
Yes.
all right. So Dr. Retana, imagine this is your this was your skin when you were in your 20s, like thick, full of collagen, like full of volume, nice and tight, right? So
It's still like that though.
Not anymore. No, we're booking an ASAP Morpheus A for Dr.
Go ahead.
Retana. So okay, so I always said, okay, this was you in like 18,
Yes.
and then when you were like back in your 20s, you lost a little bit more collagen, so therefore
Oh, no.
your skin is like lost more collagen, so therefore, hold on, it's coming.
It's about to deflate pretty
It's,
good.
it's gonna, okay, right there.
That's in my 30s?
So this is his 20s, and then this is his 30s.
Stop.
So
Stop.
so you tell me, what are you doing to maintain your collagen?
What am I doing?
And tell me what's gonna happen in 5 years from now if you don't do anything as far as skin tightening. What's gonna happen?
To preserve collagen, I'm not doing anything right now.
Okay.
No.
And what do you think is gonna happen?
Careful with that.
What's gonna happen in 5 years from now?
It's gonna continue to. I'm gonna continue to lose collagen, and my skin is gonna sag and sag and sag until I'm 90, and I'm like just a bunch of skin.
So introducing Dr. Retana when he's in his 60s, guys.
60s.
Yeah.
Oh,
So
wow.
all right. So keep that collagen, keep that volume. I'm gonna go numb our models and continue with the educating, and I'll be right back, guys.
So while Yalda takes care of our model, which it will give you guys her also Instagram account, which is doll of the DMV. I think it's doll underscore of the DMV. So she is in her early 40s. She's had 2 children, and she came to me. She's a very athletic person. She works out all the time. She stays fit. She came to me and she did a consultation with me, and I was impressed at her skin quality, right? Because she was in her early 40s, 2 babies, 2 pregnancies, and the skin quality looked really, really good. She had mild skin laxity, mainly in the lower portion of her abdomen, was mainly where her skin quality was not so good. Everywhere else is actually pretty good, pretty decent. Anyway, so her and I talked, and we talked about different options, and obviously one of the options was to do lipo 360, abdominal etching, and a BBL. Her goal was to get a booty, right? Her goal was that was her main goal. Her main goal was like, get me a booty, I really want a booty. And she was actually one of my skinny BBLs, which means that she was a skinny person wanting a booty, wanting a BBL. So what I advised her was to gain about 10 to 15 pounds for her to have enough fat for me to harvest, for me to make the booty that she wanted. She wanted projection, she wanted some hips. And so she did go on and gain the 10, 15 pounds I wanted her to gain. And then I talked to her about skin quality and how, we may or may not be able to get away without a mini tummy tuck, and that's it. So, during the surgery, I have different techniques to make sure that I don't injure the most superficial layer of her fat, which is the one right next to the skin, so I don't make her lumpy, bumpy, and more saggy than what it needs to be. So I always stay within the deep layers of the fat. And then lymphatic massages are a must. You have to do a lymphatic massage. You got to start the very next day after surgery, and then like pretty much every other day for 2 weeks, then 3 times a week, then twice a week, then once a week, then you kind of taper off. And the other thing you have to do is you have to stay. You have to wear the faja, the compression garment. She did all that to the T. And right now she's 4 months out, and she looks amazing. Again, we'll put her IG page on here so you guys can see her surgery page. And if you guys want any advice about anything, just talk to her. She's very informative, and she'll give you any advice you guys need. But anyway, so 4 months, we reevaluate, and I'm like, you know what? Like, you look perfect. And she's very happy with the results. But how can we make it a little bit better? Skin quality. We can improve her skin quality, especially in the lower abdomen and a little bit above the belly button, to make sure that we tighten up that skin, add more collagen to it in order to get a better outcome. So while Yalda comes back, I would love to get you guys to ask me some questions. Please shoot anything. Ask me any questions you have, and we'll go over whatever questions you may have. And if you guys don't have any questions, I will start.
So Dr. Retana, we have a question.
Yes.
How long will the booty last after the surgery?
Yeah. So, how long will the booty last? Your booty will last forever. So the way it works is this. I take the fat out of this area here, where no one wants fat in this area, right? And transfer over to the booty. Let's say I transfer 1 liter or 1,000 cc's of fat into your booty. The average surgeon can have a fat survival of about 70%. So let's say 30% of the fat cells died. So that's 300 cc's. The other 700 cc's are there. They survive and they stay there forever. Actually, there's a funny thing I posted on my stories today. It says, all skin cells die, all hair cells die. What was the other one? Anyway, skin cells die, hair cells die, all these cells die. And they're like, fat cells must have accepted, Jesus Christ as their savior because these fat cells have eternal life. And they do. They have eternal life. Once they survive in the booty, they're there forever. And in terms of maintaining your results, when people ask me, hey, my liposculpture results, like how long are they going to last? And the answer is very simple. They're going to last as long as you're willing to maintain them. If you let go, your results are going to go away. But if you're willing to maintain them with eating clean, diet, and exercise, then you will maintain your results for a very long time. Yeah. Hi, Tanya.
Hi.
How's it going?
Good. How are you?
This is Doll of the DMV right here for you guys. And it's about to get real with the Morpheus 8.
I can't wait.
Guys. So we're gonna spend about 5 minutes here, and then we're gonna take her back and finish her treatment. So Dr. Retana, tell us a little bit about the treatment she has had done. What are your concerns right now? Actually, maybe if I have you standing, it shows a little bit more where the...
Yeah, go ahead and stand up.
Yeah, you can go ahead and stand up. Okay, so...
Okay, so let's see here. Can you guys see it pretty good from there?
Yeah.
Alright, so go ahead and, Tanya, go ahead and lift up your arms like this. Perfect. So this is Tanya 4 months out, right? 4.5?
4.5.
4.5 months after liposuction 360 and a BBL. Go ahead and show your BBL results. That's her booty right there. Amazing. So what we're talking about today is mainly this area right here, especially the lower abdomen. How many babies have you had?
2.
And like how old are they?
20 and 12.
20 and 12, right?
Yeah.
So a long time ago, she had 2 babies. And obviously she maintained an amazing body throughout her life. And then we did the liposculpture to give her, more curves. And, the only thing that we have to just make this result absolutely perfect is to improve the quality of the skin down here. So she works out, she goes to the gym, she eats right, she does the right thing. But there's no exercise for the skin. Like, how do you exercise your skin? You cannot. But, so that's why the technology has been developed. Morpheus 8, and it's been around for a long time, and it's amazing, and I totally believe in it, and it's crazy. And you guys are going to see, we took pictures today, and we'll post the pictures
Absolutely,
a month
we're
out,
excited.
2 months out, 3 months out, 6 months out. And we'll see if we're lying to you guys or not lying to you guys. Right? And Tanya, she has a surgery page, so she's probably going to document her improvements.
I will.
Periodically. So definitely follow her. Just stay tuned. We'll give you guys her Instagram. Anyway, so this is what we're addressing. Mainly down here and a little bit up here with the Morpheus 8. Yep.
Sounds good. All right, beautiful. Have a seat. So you go ahead, have the camera in a way that we can. Is this in a zooming everything?
Yep.
We should let you right now.
Yeah, I'm gonna do that. So I'm gonna raise the legs. So I'm gonna make sure you're comfortable. You have your little stress
Me?
ball. So, guys, just to provide you with some information, Morpheus 8. We do it.
Closer.
Yeah.
We do it for the body. We do it for full face. Obviously, I don't know if you need gloves, but in case, I don't think you do. But hey, all right. So we focus a lot on the face, neck, décolleté. Anywhere there's a skin, so that means your entire body.
You see that stress ball over there?
Oh,
The one
yeah.
over there.
Oh, that's okay.
See,
Got
see,
it.
see this one? So you don't want this kind of stress ball.
No,
See
we don't.
this is not good. You
No,
want
we-
this
we-
one right here. This is a breast implant.
This was actually a commercial for get the right breast implant, so it can be also a good stress ball. So you guys can come a little closer, maybe.
If you could just
So-
put your knee down.
Yeah.
Thank you. How's the position, guys? Does
You
anyone
know what's
see?
better? I think if you guys get closer at this angle, it'll be way better.
So here's my. All right. How are we doing? Amazing. All right, guys. So here's my gun. We can go as deep as 1 millimeter, 2 millimeter, 3 millimeter, or sorry, I can have this. Up to 4 or 5 millimeter with this device. So what I'm gonna do, we have numb the patient. We put some topical for her. Also, I did ahead and numb her with some lidocaine injection to make her a little bit comfortable. So we're gonna start with a section and we're just gonna work our way through. So you're gonna feel a little zap. Ready? 1, 2, 3. Oops. Ready?
How deep are you going?
How was it?
Fine.
So I'm going up to 4 millimeter right now.
Okay.
How's it going?
I feel nothing.
Perfect. So she's comfortable.
Nice.
I'm going to go ahead now, increase the energy, guys. So obviously the energies is important and how deep we go to the skin. So you may feel now a little bit more zap and I'm going to go a little stronger. So are you ready?
Mm-hmm.
Perfect.
It's just a tiny pinch.
So if you take a look, guys, you're going to see 25 needles that it goes as deep as 4 millimeter. In addition, she's receiving radio frequency. Some patients call it RF radio frequency is the same thing. So we're delivering this energy and the goal is to create this trauma. By creating controlled trauma to the skin, your skin is forced to heal, and healing, as I mentioned, is equal to gaining more collagen and regeneration of cell. Let me know if they have any question, Najim, because I don't have my iPad.
Okay, I have questions.
Yeah, of course.
So you know that sound that the machine is making?
Mm-hmm.
Does that mean anything?
Just delivering the energy.
So is it delivering three
3 pulses at the same time while the needles is going to the skin. Guys, so usually you need minimum of 3 sessions. 3 sessions can be about 8 weeks apart. A lot of my patients ask me, so what's after 3 sessions? So keep in mind, we're not stopping the aging process. I always say, just like going to the gym, gaining that muscle. The minute you stop your push-ups, your muscles will go back the way they used to. Right, Dr. Retana?
Yes.
Honey,
how you doing? You need a break? You need a break or you good?
Oh, yeah. How's it going?
It's okay.
So share with our people.
It's just a little pinch, a little burn, but nothing that the normal person wouldn't be able to deal
No.
with. Especially with the numbing.
Exactly. So it's not the most pleasant experience, but it's worth it. No pain, no gain.
Does it feel like a rubber band? Does it feel like a
It just feels like a bee sting, like a pinch, all in the same area, and a little burn, just a tiny little burn. But
And
again,
as you can
I'm not
see
even
already,
wincing right now,
do you see
so.
her skin is already getting red? Do you see all those little marks here? So it's going to feel like you had a very mild sunburn. So my suggestion as far as, post-care, we're going to go over everything with you, but you really want to treat your skin like you just had a mild sunburn. Like, don't go take a hot shower. Don't go to hot yoga.
So don't go on a boat this weekend.
Don't go to the boat, exactly. I know, right? And then one thing I really love is we're creating all this microchannel on your skin. So meaning whatever you apply on your skin, it's going to be absorbed 10 times more through your skin. My favorite would be hyaluronic acid serum. Serum, it's a thinner molecule that penetrates deeper to your skin. So I love moisturizer, but moisturizers are usually thicker, so I prefer serums. And hyaluronic acid is exactly what your body needs. So it's going to be the best food for your skin during your recovery. Some areas a little bit more sensitive.
A little bit more tender than others.
No, but you're doing amazing.
A patient's asking, how long is the scabbing, or is there permanent scabbing?
There's no permanent scabbing. The patient will be red for 2-3 days. It's going to feel a little uncomfortable, but honestly, after the 3rd day, your skin is back to normal. It feels like, again, hot
and
irritated, like sunburn maybe.
Yeah, that's exactly right.
Patient asked me, can we do this treatment during summertime because a lot of people get tan? Absolutely. You can do this treatment even if it's during summertime. You are doing amazing and the energy level is really good. I'm so excited. So
So does it really? It doesn't really scab, does it? Does it scab?
It doesn't scab really. It just creates all this redness and this little like
So I say
dots.
the healing process, like you see the redness for how long? 2-3 days.
2-3 days. 3 days max.
Of redness, and then it turns like this little brown color, right?
Sorry, baby.
Like the little dots turn into this little brown color, and then it kind of just fades away. Yeah.
All right.
So Tanya had a photo shoot this weekend, and we told her not to do the photo shoot.
No photo shoot. Absolutely
She
not.
was going to be at the, I would say she's probably going to be past the redness
All right,
stage
guys. So
into the browning
Jillian,
stage. And
we can go ahead now. Take her back to the treatment room to continue that.
if you can
So
go over.
yeah, come a little closer. I want to show everyone what everything looks like.
So you guys can see the little dots.
The little redness, the little dot. It's like creating this trauma. So all this redness, it's gonna go away within the next 2-3 days. It's so important to keep the skin hydrated. Hyaluronic acid, that's my to go. No exfoliation, don't go hot yoga, don't go outside to run. You just want to take it easy for the next few days. And we'll make sure we'll give you a post-op
And this is not the
instruction.
completed treatment, right?
Yeah, so what we're going to do, Dr. Retana and I, we're going to continue. One of the esthetician will finish your treatment. And you did amazing.
Thank you.
Of course, any
a
feedback,
pleasure.
any experience you'd like to share with our audience?
I would just do it.
Just do it.
The pain doesn't, the results outweigh the pain for sure.
Absolutely.
So can you share with them your surgery page?
Yes, so I am doll_of_the DMV on Instagram. So follow me. I have nothing but great things to say about Dr. Retana and Nurse Yalda. So.
I'm humble. Thank you so much.
You're welcome.
I
The
appreciate
important
it.
thing is ask her any questions you may have, because
Yes.
I know that many people have reached out to her to ask her all kinds of questions, right? And whether you're in California or in Italy right now, it's the same thing, right? You're choosing your surgery, you're choosing your treatment, you're choosing the right thing
Yep.
for you. Even if I'm not your surgeon, or Nurse Yalda's not your aesthetic nurse.
Yep.
Reach out for advice from
Yeah.
people
It's
who
really
have
the patients that know.
who
Right.
have known things, who have
Yeah.
done things. Yeah,
Yep.
correct.
Our goal is to share our knowledge. Our goal is to make you guys maintain your beauty, enhance your beauty, look natural, feel good inside and outside, and those are all connected to each other. So that's our goal at the end of the day.
Our goal is to empower you to look amazing.
Let's do this. Amen. All right, thank you.
You're welcome.
So Julian will take care of you. Thank you. All right, sir, we're going to be back to...
All right, guys, questions.
This-
Okay, here we go. This one right here. Crystal Almario says, will it be a problem if one has a history of keloid scarring? What do you think?
Not at all. I don't think this trauma is going to be causing anything that can create keloid. I mean, I'm not injecting you with anything like that can cause. I'm not cutting. It's not that invasive.
Yeah, I none of the studies that I've seen have shown any keloids, or I haven't seen any bad reactions on patients with keloids. Obviously, there's always a risk, because when someone keloids, right, your genetic predisposition is to form too much collagen to injuries, but it's like to deeper injuries. This injury is kind of like a very superficial, very mild injury, so
Absolutely.
it's kind of like you saying, "Oh, I keloid because I scratched myself in the corner of the table, and now I have a keloid."
Yeah.
Not really. So I mean, this technology goes deeper than that, but no. But that's a great question, though.
Thank you. So I'm going back. Oh, thank you so much for all the lovely comments. It means the world. I think one thing Dr. Retana and I we have in common is like we love what we do. I don't think we do it because there's any other reason that just it comes from our heart. We truly enjoy it. We're both our focus, young, excited, and we just want to provide the best.
That's right.
And we both have we're all like just black mamba mentality, right,
That's
Dr.
it.
Retana?
Mamba mentality.
Yeah.
Just get better every day. Do the right thing, and that's it. And then do it with love. Like I don't know.
Dancing.
Someone says,
Dancing.
Will Dr. Retana be dancing with us?
Yeah, I know.
Of course, if Nurse Yalda wants to dance,
Yeah.
we'll do like a, what do you want? What do you guys want us to dance to? A little booty dance, little salsa, merengue, bachata.
Bachata. So
merengue.
I think who's our DJ here,
Well,
guy?
we can do some, Iranian stuff.
Iranian dance. Yeah, we're we don't discriminate anything. You guys just pick a song or something. We'll is Nikki available, our DJ?
Oh, you want somebody wants soca music? That's like
What is soca music? I don't know much. Nikki, do you know anything about?
Soca is like
Your what is?
We'll play some soca. We'll do this. We'll end the live with some music in the background.
At the background,
maybe some soca, maybe some reggaeton. We will be dancing. But you guys, I want to see you guys dancing in your house. Like I
know.
can't see you, but I want to feel you. Dance with us, okay? So if you're asking us to dance, we will dance.
We're gonna dance.
I want to see you guys dancing too.
But then we want you to take like a selfie or something and tag us.
There you go.
There you go. That's it.
There you go.
And
you guys,
whoever
at the end of this live, do a dance and tag Nurse Yalda and myself, and we'll give you a prize.
Oh yeah. We got you.
Do the giveaway.
We're gonna have a giveaway.
The best dance will get a giveaway from Nurse Yalda and myself.
We gotta promise.
That's it. That's easy to do.
Oh yeah, that's easy. I think everybody got some move.
Make sure you tag us though.
So, Dr. Retana, we have about 6 more minutes.
6 more minutes.
Is there anything else you'd like to cover?
One more surgical question, Dr. Retana.
Absolutely.
Someone's asking, do you do calf implants?
In my training, I've done calf implants, and I think they're good. But you know what is better than calf implants? Just like if you were asking me, do you do gluteal implants? I would say, yeah, I've done gluteal implants in my life, in my training. But you know what's better than gluteal implants? Fat grafting to the booty. You know what's better than calf implants? Fat grafting to the calves. Why? Because it's organic. It is not a synthetic thing. My favorite implants in the body
Just
are...
the breast?
Well, 2. My favorite implants in the body are breast implants and chin implants. Those are my favorite 2 implants in the body. They behave really, really well and have a long track record. My least favorite implants in the body are gluteal implants. I don't do them.
No.
And the second least favorites are calf implants. The best is fat grafting. And I can show you some before and after photos of fat grafting patients that I have done if you're thinking about calf enhancements.
I agree, guys. I have seen some really bad results that patients were not happy. I don't think it looks natural. So,
Well, and the other thing is it's such a mobile place. Like your legs, you're using them every day.
Constantly, or your
moving,
glute,
walking, running, doing all kinds of things. So they tend to maybe move around and that kind of thing. And long term, in the scar that you need to create to put them in, I'm not a big fan, but fat grafting is amazing.
Soroush is one of the top injector, trainer, allergen. She's all over. I'm so honored. So she had such a beautiful question. Have you tried treatment on hands with Morpheus? Sarah, not really. That's maybe something that I can look into it. My concentrations being mostly face, neck, and body. What I have done is have some dermal fillers, but I haven't done. But that would be something that totally I'd be.
I totally agree. Thank you for that, Sarah.
Thank you. That's beautiful.
I mean, I think that's the thing about the technology. Morpheus it's so versatile. You can use it in so many places. The rates of the chances of a complication is so low, right?
Yeah.
And the benefit is up here. So like when a treatment has such a good track record, number one, and it's a huge ratio of benefit to risk ratio, right? Then it makes sense to do.
Yeah, very true.
Like what I was just saying about calf implants and gluteal implants, it has a benefit, but it's got a big risk. So to me, when a surgery is like that, I would say not really the best thing to do.
Agreed. Yeah. So since we do have some doctors, injector joining us as well, I just want to share one thing from my experience. I have had so many great people. Sarah Safa is one. Ashley, Brandon, Dr. Retana, you guys are being so supportive, so kind. This is all teamwork. I think there's no such a thing as competition. There's enough for all of us. Our goal at the end is just to make our patient look good, feel good. So I'm always here to answer anyone's question. I'm sure he's always available.
Yeah, just to piggyback on what you're saying, like your message there. By the way, someone's here saying Linda Webb's like, Nurse Yalda gave me a chin and she has changed my entire profile. And I'm sure she changed your life. She's amazing. We have 2 minutes left. We're going to be doing some closing remarks. Guys, like what Yalda was saying, like, there's no competition. It's just, there's enough people, there's enough patients for everybody. We're just here treating people, treating patients. improving lives, making people feel better about their bodies. I love the fact that we're in DC. Like when I chose DC to be the place where I'm going to practice for my next 30, 40 years of my life, this is where I wanted to be because I call this home. And I'm so glad that I've met people like Yalda and other injectors in the area, other surgeons in the area who continue to put out good results, right? And I love the fact that we're putting out good results.
I'm excited.
At the level of estheticians, at the level of nurse injectors, at the level of surgeons, at the level of all kinds of providers, because we continue to put DC on the map. And DC has not been on the map in the aesthetic world for, I believe, a long time. But now we are. And everybody who's listening to this is from the DMV, who's proud of me from the DMV, because I'm proud of me from the DMV. I grew up here, I went to high school here, and I've been from here for a long time. You guys should be proud because we have amazing providers in this area.
We sure do.
If you need something, we're here. You don't have to travel. You don't have to go to another country. You have to go to another area of the country. People are coming to DC to see this girl. People are coming to DC to see me and other providers in this area. We are a great industry here in DC to get what you guys need done.
And then the last thing, guys, we're so blessed to be where we are. If you look at the other part of the world that people are struggling, like we're so lucky, we're so blessed to be here. So love each other, be kind to each other, spread the love, and we're so lucky. Again, just a reminder. So now we're ready. Our DJ.
We're gonna play some music. We need to be ready with some music, though.
You ready? I don't know, guys. I don't know what's going to happen.
While we get the music ready, that's an important message that Yalda was talking about. There's so many people in Lebanon, Afghanistan. Even I was talking to some of my buddies in Latin America, Mexico, and other places where people they're struggling. People. This pandemic.
Daddy Yankee everywhere.
This pandemic has been
eye-opening.
An eye-opening thing. It's been detrimental. It's been a roller coaster of emotions, and we now see it in the whole world. But you know what? We gotta celebrate. We gotta celebrate that we're alive, that we're here.
I don't know what we're doing.
All right, everybody at home, come on,
come on. We're gonna ask for.
Tanya, come over.
Break her. Come on, Nikki. Come. Nikki, Ben, you gotta come. Come on. Gerardo.
Come on, guys. Record a video at home and tag all of us. Okay, ready? Hey, despacito. What is this? Hey. Dancing, come here. Go ahead, come on. Hey, come on, lady. Come on.
Come on, Nikki. Gerardo. Bring Gigi. This is the craziest ever. I'm in the middle of it.
Look, it's getting oh my God, careful.
Come, are we done? No, Gerardo. Come, you need to Despacito. Nikki, come.
Ready?
Despacito.
Okay. All right, guys, take care.
Thank you.